So as a dental sleep medicine provider, how do you gain more leverage with referring physicians? One of the things you can do if you're running a targeted social media ad campaign and you're generating leads, or you're actively screening your patients in the chair in your dental practice, you leverage those. You leverage those patients that you're bringing into your office. And here's the exact steps you need to do in order to reach out to those physicians and get them to start referring to you. Do not go to their office and try and schedule some kind of lunch with them where you can explain and educate that physician on the validity or efficacy of dental sleep medicine. They do not want to hear your spiel. They already think you're driving outside your lane. Here's what you do. Have your administrative staff person reach out to the administrative staff person of the referring physician. Maybe it's an ENT, maybe it's a cardiologist, urologist, whoever. Have the admin staff, your admin staff, reach out to theirs, and then say, we have 60 to 80 patients reaching out to us every single month wanting oral appliance therapy. We need to be able to work with an ENT that we trust. Is that a conversation your doctor would like to have with ours? Now, in the administrative community, there's a much different relationship between those people and physicians and doctors. That's a different relationship. Administrative staff, they trust one another because they're both dealing with the same headaches on a daily basis. So when your admin staff reaches out to another admin staff at another office of a referring physician, there's already some mutual camaraderie there. And you have all of the leverage because you're the one who's looking to refer your patients somewhere. So give that a shot. Have your admin staff reach out to the other admin staff of the referring physician you're trying to connect with. And you're going to have a much better success rate in having those conversations.